want to network and mentor and provide career growth to Indian youth who have migrated to United States. And we want to celebrate the diversity and the Indian culture as well. And community, we want to connect with the local organizations, the organizations which are in the university and different groups across United States, and facilitate our Indian diaspora and Indian youth in the US. There are many initiatives and programs organized by Bharatiyam, one being Awaz. This talk today is part of Awaz, that's also called Voice of Reason, where, next slide, please. So what happens is, like, Indian youth or the youth in general usually gets like this misguided messages and a lot of noise and half-truths from different people around them, or even the newspaper or different articles have different views. So we at Awaz want to kind of filter everything and provide unvarnished truths about different current affairs and the topics across the globe. So as I said, Awaz is an initiative of Bharatiyam Student Council, and our aim is to help youth think fundamentally and communicate and reason about the current topics. So here at Awaz, we also have organized almost 8 talks since past years. And there are also other programs like Geek Talks, where we do knowledge sharing. We also have a COVID-19 helpline, which runs 7 days a week. And we also invite like experts who are like kind of SMEs or subject matter experts in their field, who come with us and kind of share their views and facts, such as today. So moving on. If you want to know more about Bharatiyam, please join us at bharatiyam.us. You can check out our FB page. We are also available on Instagram and Twitter. So yeah, you can check us out that way. And for today's webinar, we have a very reputed and bright speaker with us, Professor Shamika Ravi. And I would like to welcome Professor Ravi on behalf of the organizers of Awaz and Bharatiyam USA, and of course, myself and the audience here with us. So many of you might already know Professor Ravi through her very presence online and offline. She has very popular Twitter handle, and even then, I would like to give brief introduction about her. So Dr. Ravi is a non-resident senior fellow of governance studies program at Brookings Institution, Washington, DC. She was the director of research at Brookings in India. She is the former member of Economic Advisory Council to the Prime Minister of India, and her research focuses on the growth and development of India, with particular emphasis on development finance, health economics, gender inequality, and urbanization. Professor Ravi is a visiting professor of economics at BITS School of Management and Indian School of Business, where she teaches courses in game theory and microfinance. Professor Ravi publishes extensively in international peer-reviewed journals and writes regular opinion pieces in major newspapers. And her research work is regularly featured and cited by major international media outlets and most national and regional newspapers and magazines across India. And more recently, she has become a household name, as I said, thanks to her daily statistic updates on COVID-19 in India, which I myself also follow. During the, after the talk, if you have any question, please post them in chat room. Bharatiyam question is the chat room handle where you can put your questions, and after the talk, we'll try to address them. With that, I would like to invite Professor Ravi to share her views on today's topic, evaluating India's response on COVID-19.
Thank you, Vidhi. Thank you so much for that wonderful, warm welcome and introduction to Bharatiyam. It is such a great pleasure to be with the community, which many have termed the living bridge between the two countries. And from the profile of what the organizers told me, it appears it's also a young, vibrant living bridge. So I think this opportunity to reach out and connect with you is truly an honor. Thank you very much for it. What I have today is, the topic given to me was a very precise one, thankfully. Public policy talks tend to be very broad and very general, and therefore, having a narrow specific topic has made my life easy, because all of us are in this together. The pandemic has truly been global and raging across every country. Even countries that have not been terribly affected, public policy has everywhere been focused, the priority wise, it has been a COVID. It has impacted every aspect of a community, a nation, and India is no exception. Sitting in Delhi, and of course I travel extensively throughout the country, but sitting in Delhi, I can tell you it still remains priority number one. It does occupy a very large part of everyone's mind space. And I'll try to bring forth a set of objective views based on data. And the reason this becomes important is because it's a noisy, and I'm glad the introduction to Bharatiyam was also about, forums like Awaz can help put out objective information, because it is it's a noisy space. You hear a lot. And of course, this is also the age of misinformation. It is very difficult to tell what is credible, verifiable information from opinions of people. And sometimes it could also be mischievous. But a lot of times it is really just noise. So the talk today will try to cut through that clutter to make some sense, given our own experience in India, and do a little bit of global comparisons, but mostly focus on our own country and economy. And towards the end of it, I will try to perhaps focus a few minutes on the role of media. So let's start off by first looking at, this is really the overall picture. And for many of us who have been mapping this pandemic right from the beginning, when the numbers were indeed very few, but if you recall, we were getting very scary projections, and the rate at which it was expanding in many of the OECD countries, particularly Western Europe. We were seeing what was happening in Italy. We were seeing the horror stories unfold out of Belgium and the UK. We had good data, but indeed frightful data coming out of Germany, coming out of Japan. And those were really the basis for us judging which way the virus would go. So a lot of the early projections that were made for India were based from those early parameters. Now, the early parameters were indeed truly scary. And I think it's because of those very, very drastic pictures that were painted. And for those of you who are unfamiliar with India's health infrastructure, 75% of our health infrastructure is private. But communicable diseases, and this is where now the economics of it will come in, communicable diseases means there are very strong externalities. And therefore, the role of public health becomes fundamental. Very few communicable diseases can truly be handled at community level merely with the use of private sector. And that's because in these kind of outbreaks and diseases, TB included, and we've been living with TB now for decades, we lose roughly 4 lakh people, 400,000 lives a year, that is one estimate, to TB. Now compare that with 1.6 lakh deaths of COVID. It's an important perspective because it tells you the reality of our health infrastructure and what we have been living with, what we are used to, and the way the community and the infrastructure can be mobilized in times of need. It tells you about a larger presence of diseases of the nature that makes India a little more vulnerable on many counts because it is still extremely limited health infrastructure, but also in many ways prepared from the point of view of it's not that new. It is not, mobilizing local level resources for vaccinations, etc., for these kind of diseases is not a very novel idea. We are used to these kind of diseases. Now, this is the overall picture. What it tells you is there is a very large number, above 97%, who have recovered. And recovered. Can everyone mute themselves, please? Thank you. A large number of recovered people also means there is a large population out there which is carrying antibodies. That's number one. Number two, remember these are confirmed cases, meaning cases we know of having tested them. But the nature of this virus is such that, and the nature of policies globally has been such that when you show symptoms, when you come in contact, you get yourself tested. In India, most people who have been infected have been asymptomatic. And most people who have even developed symptoms, they have been extremely low-grade symptoms. We've had relatively fewer hospitalization and fewer deaths. Now, that is where you make a distinction between a case fatality, meaning for 100 cases that have been discovered, how many lives were lost. But then there is an infection fatality rate, meaning by and large, how vast is the infection? And the infection is clearly much, much bigger than what we pick out from the testing. And therefore, the infection fatality rate tends to be much smaller. But this graph tells you, having tested what are confirmed cases, and even here with a 97% recovery, and you'll see the deaths. And of course, 1.57, I mean, these are still very large numbers. But again, that perspective is important when you compare with TB, or when we know that 1.5 lakh deaths happen due to road accidents. You know, this perspective is important now, particularly a year since we now know the virus. And I think there is a need to tame the fear. While it's very important to maintain the protocols and still stick to the clarion calls of do gaz ki duri, social distancing, or masking, hand hygiene, and all of those protocols still remain very, very important even in India. However, an overall perspective is required so that the unreasonable fear and the kind of petrification where people just didn't know what to do, I think that can be put to rest when you see these numbers. So that is the overall picture. This is what typically people follow. This is what epidemiologists follow. And hence we started following this right from the beginning. Let me also tell you one of the reasons why we started to do this analysis right in the beginning is because, you know, for a country the size of India, and while the policy level, I think mobilization started very early on, we're not very good with data systems and particularly data analytics and communication of data analytics. So it was really an endeavor to fight the unknown and the fear factor by putting out information which was credible, verifiable. Anyone could go and just run our codes and get these results. But the data we used was from the Johns Hopkins. But of course, there were certain metrics which we started analyzing several weeks before Johns Hopkins also did it. But gradually, lots of volunteers, lots of young people like yourselves across India started to volunteer and put data together. And COVID-19India.org was one such volunteer organization. And they were able to then put disaggregated data together for at the district level sometimes, but definitely at the state level, which was very credible. So we started to do this, and I began to share this on a daily basis. It was really a professional service. You know, this is not the kind of research we typically do, you know, as empirical economists, but this was very valuable because it sort of did help dispel fear, and a lot of people came to then follow this on a very regular basis, so much so that I would start getting calls and SMSs early in the morning. If it became 9:15, they would say, "You usually put it up by 9, what happened?" And I would have to tell them, well, my kids, one of them has a test and therefore needs me to be around in case. So, this was really something which I think many of us being in lockdowns, being in homes, started to innovate and make ourselves useful in ways that we were best suited. Now, this graph tells you that, look, things really did escalate for India. We were getting almost more than 95,000 cases a day at the peak of it, which was middle of September. But from September 16th onwards, our cases did begin to steadily come down. Now, this is also a place where we have to be modest in our own claims and know that management, meaning policy interventions, is a very large part of how you deal with a pandemic like this. We are a very large, a federal country, which means, and you know, health is a state subject. So while a lot of the policy making and guidelines were being developed within Delhi, the implementation is really a local level one, which means an ordinary citizen's experience with the pandemic, meaning how many beds are there, what kind of testing, all of that is truly a function of what is the local level infrastructure. Right? And implementation, you know, from designing and advocating and communicating a policy from Delhi to finally implementing it in a block in, let's say, Meghalaya, Tamil Nadu, Uttar Pradesh, Rajasthan, the experiences can be very different because the country does have very, very diverse nature of health infrastructure available across different states. So I think it's important to recognize that it's a large country and national level data of this nature. It tells us something, but it also hides a lot of the variations. That's number one. Number two, since it began to fall, how much of it is management and how much of it is nature? It's very difficult to tell. And we have to be honest as researchers that parsing out that variation, of course, management helped because it gave a lot of clarity to what needs to be done. And unlike many of the Western countries, in the US in particular, and I think liberal democracies generally tend to have a huge spectrum of responses, there were no protests against masks. The compliance was almost universal. Now, people didn't always have the right mask in the beginning, particularly. They didn't always wear it right. People jumped quarantine. But, you know, for 1.38 billion people, you have to look at, on an average, the compliance was exceptional, nearly universal in all aspects, right? If you just look at economic activity, and I'll show you in a minute, compliance very, very high. Mobility fell to very low numbers in the beginning, the first few weeks. So there is management, and then there is nature. So there is government, which is part of management, people that are equally responsible, and their response is very important to gauge overall what happens. But there is also nature. Immunologists, virologists will hopefully over time tell us that why was the death per million so low in India? Why is the virulence of the virus seemingly low in many parts of within our own country? Now, that the science of it will evolve. And that's why I think it's important to be modest in our own claims. But the fact is, today, India does have one of the lower deaths per million, does have relatively fewer hospitalization. And it is not because data is bad. It is something that is verifiable. There is a lot of media scrutiny, courts scrutiny. And in open democracies, and we do have a paper on this, it's very difficult to hide deaths of the magnitude that, in the beginning, people said India is hiding numbers and so on and so forth. Over time, you realize that the data on an aggregate, these are very credible, verifiable, and truly we have come out on the better side of things if you count deaths and even cases. Lately, in the last 3 weeks, we have seen a mild resurgence. But again, you can see in the last 2-3 days, it has begun to get muted. Now, testing is a function, how many cases you have is also a function of testing. But you will see that while cases began to decline from middle of September, you see that testing remained on an average around 1.1 million per day, all through, right, from September all the way until January. And from Jan, by then, the numbers had begun to come down. So I suspect because it's mostly people who felt symptoms who would go and get tested, you'll see testing come down. And again, you have seen that with the resurgence, the testing has again begun to pick up. So which is why we say that it is not, the decline in the numbers that happen at the end of fall is not just because we started testing fewer. The testing remains steadily quite high per day. When the numbers fell from 95 per thousand to almost 10, 15 per thousand. So that steadiness, it's not because of, we can be sure that the cases did indeed come down, and it isn't a function of testing. Now, if you look at what was our testing experience, remember our public infrastructure, testing infrastructure, we had very few labs. And within weeks, within the first 2 months, nearly every district or every state for sure, but definitely, in the heartland, or if you look at the most of the urban areas which were a hotspot, testing centers ramped up very quickly. And these are all ICMR approved. Because the guidelines were being set up by ICMR. States like Nagaland didn't have even one testing facility, and very quickly they were able to mobilize and get several. So test positivity rate told us out of every 100 tests, how many cases were positive. And you'll see that, and 5%, by the way, is the WHO benchmark, that you shouldn't have more than 5% cases coming positive, which means you aren't testing enough. You really have to be ahead of the infection. Now, on an average, you'll see that we went as bad as 9%. That was our high. But then since then, it has steadily come down. And now we are at what that global benchmark is. And of course, a lot of it is on account of the fact that last 5 months, the numbers have been coming down while testing has remained quite high. This is the cumulative one. India is a very large country. So what I'm showing you for India, there are huge variations across the states. Maharashtra has continued to have double-digit test positivity rate throughout the pandemic, and that has been a concern. If you look at the daily cases here, this is just to give you a snapshot of how large this country is. And sometimes I find it incredible when we compare ourselves with individual nations, how New Zealand fared, how some small European country fared. And, while it's a fair comparison, if you think of cross-country being one point of analysis, but it's a continent truly. And the experiences of different states have been so diverse. If you look at, these are different states. If you look at Maharashtra, that is the second graph on top, second column, the first. Maharashtra has had a huge resurgence, but Maharashtra also had peaks which went up to 25,000 per day. Now, this is only Maharashtra, mind you. While the country as a whole had 95,000, Maharashtra, for a large period of time, was reporting almost 1/3, first half, and then 1/3 of our overall cases. Kerala did not peak when the country peaked. In fact, Kerala continued to have 6,000 to 7,000 cases a day for several months after India had peaked. It's only over the last couple of weeks that we are seeing now Kerala numbers improve. Now, so you can see this enormous variations across the states to really appreciate the nature of the problem. The case fatality rate, this tells you out of every 100 cases, confirmed cases, how many lives did we lose? Now, the one good thing is, and you'll see India in the first column, the third row, that is all India. At the all India level, as is expected everywhere, so that is also the global figure, case fatality rate has steadily come down with time. And that's because for every new 100 cases we discover, we know the virus better now. We know what the testing, well, it's not cure, it's really the treatment protocol ought to be. So because of knowledge, more information about the virus, we are losing fewer lives, right? But if again you look at the state level, different states have had very, very different experiences. In fact, even today, and Punjab does remain an anomaly because Punjab's case fatality rate kept rising. In fact, it has been more than twice the national average. And it's continued to grow for months and for months. And that is truly outstanding if you consider that every other major state, Maharashtra, where there was a time when the top 5 out of 10 districts were all from Maharashtra. So things were quite bad. But even there, if you see, the case fatality rate has been coming down. Today, so much so that case fatality rate of Maharashtra is less than 2.5%. Remember, all India is 1.4. Maharashtra, 2.5%, less than that. Punjab is above 3, still 3, 3.2, 3.25. So that's a very huge variation if you consider the experience. of different states. Remember, case fatality rate is also a measure of how well you've mobilized resources, how well was the inpatient, the hospitalization, oxygen support, overall, how many lives are getting lost. Now, if people get tested very late, and I think there was some resistance to testing in Punjab, you will see that people, by the time they come to the hospitals, it's late. It's very difficult to resuscitate and so on. But it was a combination, and I think management, therefore, does play a role. Having enormous variation across states, case fatality rates is more an indication of the way the pandemic was managed. And that had to do with early detection and treatment, right? But Delhi, Maharashtra, I mean, Delhi, Bombay, seeing huge numbers, but even there, over time, case fatality fell. This is the same case in Gujarat, Rajasthan, big states, Haryana, Telangana, again, hotspots, but the numbers did come down. This is telling you overall case fatality rate across states as they stand today. The global case fatality rate is 2.2%, 2.22%. Two of our states, Punjab and Maharashtra, are significantly above. In fact, Punjab is way above the global case fatality rate. But you'll see that a majority of them are below, all but two are below global fatality rate. And within India, while it's 1.41%, you'll see that very many states have had relatively fewer fatalities. But this is the metric that we started very early on by saying, you're only picking up cases that you're testing. There is a huge variation. You need to take into account the population size itself. So deaths per million is truly a good measure of eventually what is the cost in terms of lives of this pandemic. And here, Delhi does stand out. Delhi has had a lot more deaths per million than all India average is, of course, 114 deaths per million. Delhi, Goa, Pondicherry, huge hotspots, large number of deaths. Ladakh has, if you remember right in the beginning, when cases were coming out of the Nizamuddin area, and that was a super spreader event, and contact tracing happened for more than 30,000 people across the country. Ladakh was one of those early hotspots, and it remained one for a very, very long period. But there are many states, Haryana, West Bengal, Tripura, Gujarat, MP. I mean, these are all states which, despite high numbers, have had relatively fewer deaths than all India. This is India's case fatality rate vis-a-vis the global case fatality. And here the global includes India. But you see a sort of in economics we call it decoupling, but basically over time case fatality rate has fallen significantly across the world. Lately, I think it's on account of Eastern Europe, where you are seeing a surge in deaths. You're seeing the global numbers begin to pick up again, which is quite unfortunate. The Indian numbers, the case fatality rate continues to decline, but of course now the decline is very, very slow, 1.41%, for quite some time now. This is our total vaccinations. So we are at a point in time when we're getting around 15,000 fresh cases a day. And now the race is really between new cases and the vaccination itself. I'm happy that finally we've breached the 1 million per day yesterday. Of course, this number is still March 2nd. But I'm really looking to analyze the last 2 days. With the opening of vaccination to private hospitals, the eligibility criteria getting relatively more relaxed now. Earlier, it used to be the health workers and the frontline workers. Now it's open to everyone above 60 and everyone above 45 with specific comorbidities. The numbers are rising, and these are the daily numbers. The gray bar is daily cases, and the pink is the daily vaccinations. You'll see that, of course, you discover cases because testing happens even on Sundays, because the virus doesn't take days off. But the vaccination drives, we are seeing weekend effects, right? But quickly, I think it started on Jan 16th. So in a couple of weeks, we'll start looking at 7-day moving averages. But you're seeing that the numbers you can see very clearly that the numbers are increasing. They need to increase even more. With opening up and the private sector coming in, we are likely to see a much, much more rapid growth of vaccination. And now, the Covaxin, the interim results are out. The chances are, it will be ramped up because until now, 90% of vaccines given in India are the Covishield, the one from the Serum Institute, which is with collaboration, the AstraZeneca with collaboration from Oxford. The Covaxin is the ICMR and the Bharat Biotech. Given its efficacy and its safety levels, it appears that it's just as good, if not better. So it might get ramped up. So the supply, but supply hasn't really been the constraint right now because we're sitting with a good stock. It has mostly been the way we have opened up and what are the facilities in private sector was not included until about a week, less than a week. So, but this is the overall snapshot. Fatality rates have come down. The cases have come down. India vis-a-vis rest of the world, most major markets or nations are still seeing sort of a plateauing. What you have seen, the black line is India. This is Feb 16, so it's a bit dated, but 3 weeks. Indian numbers have steadily been coming down, lately a little bit up, but you can see that India truly does stand out if you compare it with the major hotspots in the world, where numbers continue to, these are active numbers. Now, of course, this is also a bit, the data itself, beyond a point you have to understand that you're seeing several peaks in South Korea, Japan, etc. US has stopped reporting recovery numbers as it used to earlier. And it's on account of that that all of them are getting piled as active cases. UK similarly has been very, they have not reported recovery numbers, so they all show as active. But this is the Johns Hopkins data. Overall case rate, meaning out of 100 people in the population, how many have been infected? Again, case, meaning by test, not the infection. And look at Czechoslovakia. Czechia was one of the countries that they had the universal mask drive in the beginning, and we were very sure that that might be the right strategy and Czechia will come out of it. Czechia today has 118,504 cases per million, which is very, very high, the highest in the world. But you're seeing what is happening with the rest of Eastern Europe. Eastern Europe, you're seeing between the purple dot, which was on October and today, biggest increases, right? So Eastern Europe is still seeing a massive increase, but so is the rest of Europe. The US continues to see large numbers. India, our cases, we have around 8,000 plus, 8,100 cases per million. China, of course, has been extremely guarded with its data. There has been absolutely no change if you consider the death rate, for instance. This is the death rate per million. China was 3.3 deaths last March when I started analyzing, and today it's 3.4. But that's China. We know of China what China wants us to know. And therefore, the kind of scrutiny you're likely to see and the kind of data you're likely to see from democracies, these are not really the best of comparisons. But it's there because this is what we have, and it's important to see the numbers while you know what is the institutional sort of the background to this. But again, the deaths, we are 114 per million. Czechia, I mean, it's close to 2,000. I mean, these are very, very large numbers if you compare how we've, fared. Coming to the economy, because COVID has also dealt a huge blow on our livelihood, our economy. Most of the countries that we compare ourselves with, or that you will see in the popular press, it's with the OECD countries. Now, OECD countries are many, many-fold richer than us. China is 4 times richer than us. So decline in GDP, this is the data from the first quarter. This is a study out of Brookings that came out 3-4 months back. You're seeing that in the first quarter, how does the decline in GDP compare with the deaths per million? And you'll see 2 bunches. There are European nations which have had many deaths, and they've also had a decline in GDP, which is high. Makes sense. There's fear, there's lockdown. And then you have this bunch on the left, India, Philippines, few deaths, but big decline in GDP. Now, this is on account of the fact that given our health infrastructure, a stringent lockdown was perhaps the only strategy available to really stop the spread. Given that we don't have the health infrastructure to manage the kind of infection surge and possible hospitalization which was expected out of this, that seemed to be the best strategy. Now, exposed with the benefit of hindsight, we can say, well, perhaps we could have done things differently. But remember, this pandemic has been truly a test of trial and error in every country, including smaller island nations like New Zealand, which has gone into a lockdown a few days back after doing fairly well. But you have to understand that in the beginning, the kind of lockdown which was imposed seemed to be the best strategy to cut the transmission, because our health infrastructure just couldn't manage the kind of surge that European nations saw. This is a data which I love because it's totally verifiable. I encourage those of you who are interested in data sciences, go and look at this data. It's freely available. Google mobility data. Anyone with a device is really part of this data. This is telling you mobility to retail and recreation, which is a very large category, but it tells you how mobile are people within the nation. And you see what happened when the lockdowns, when countries went into lockdown, huge crash in mobility. I mean, we declined minus 85% decline in economic activity, which means the whole nation is truly in a lockdown. There is very, very little movement. And you saw this across different countries. But what you also saw is that the European countries, the Western European countries, very quickly, within a few weeks of lockdown, began to relax the lockdown, and the mobility rose up again. In fact, we saw pictures of Europeans dining outside and enjoying summer, etc., while Indians remained indoors. And we used to be quite envious, thinking, this is the price for being a poor nation. We wished that we could be just as mobile and open and as some of the Western European countries. But again, in hindsight, what it tells you is that this quick opening saw greater economic activity. So the GDP in these nations picked up, economic activity began to surge. But over the summer, they had a resurgence of the infection, which was much worse than the first. So you really saw a big, big second wave coming, which again brought the mobility down. So what you see is opening up and rising economic activity again begins to crash post the second surge. India, in the meantime, because our lockdown or unlockdown was really very gradual. Till date, the schools are closed. So it's been a year now, children are at home. So you can understand that the level of movement has been very restricted. So we truly have paid a price, in every aspect. And schooling is, of course, the one that comes to mind most immediately, because it's been a year and kids are at home. You see, India's economic mobility began very gradually. It's been one of the slowest countries to recover, but it's been steady. We have not had the kind of second, third big waves. And hopefully, again, this recent surge of last few weeks is also reversing. But anyway, these are open-ended questions. We can only know with time, but it appears that the steady increase is truly it's monotonic. We are increasing our economic activity. The latest GDP numbers are telling us we have finally grown. We've shown a positive growth of 0.4% after 2 consecutive declines. But huge variations within the country. UP, minus 16.5%. This was again end of February. Maharashtra, minus 30%. So you're seeing that economic mobility is also a function of how the infections are getting, how it is spreading in those. UP, Bihar, etc. have relatively, despite having lots of tests, they have had fewer cases, and definitely a lot fewer if you control for the population size than Maharashtra and Delhi and Karnataka. So of course, these are also more urban. So the expectation, the virus has been largely an urban phenomenon. So economic mobility has been growing much faster in several of the relatively rural and bigger states of East and North than most of our West urban states. This is the latest IMF projections. India, minus 8% decline overall in the last economic fiscal year. What you're seeing, the projection for next year is India is likely to have the highest growth with 11.5%. And you're seeing this on account of the fact that we have not had a resurgence in the virus. Economic activity, in many ways, it's not like aggregate GDP data. If you look at high frequency data of the kind Google mobility that I showed you, you look at GST collections, you look at demand for fuel, demand for electricity, etc. There is a pickup. And that pickup, it's sort of consistent with the overall projections. And I think that is why you are seeing these kind of projections, that India is likely to be the fastest growing economy in the next fiscal. Of course, in the meantime, the government has used this period to also bring in huge structural reforms, which we have not seen in the last 30 years since India started to open up in 1991, namely agriculture. Now, agriculture, of course, the farm laws remains logjammed because of the northern, in particular, the more affluent states of Punjab, Haryana, and Western UP, where you have larger land holdings, big farmers, etc. But the farm laws have been welcomed in most other parts of the country. Agriculture reforms have been something that economists across the political spectrum have actually been writing and recommending now for 4 decades. So politics apart, agriculture has been, a huge area or gap in our reform process itself. We have really turned a blind eye, and it's about time we begin to truly, bring in serious reforms in agriculture, because we still have more than 40% of the people who are exclusively dependent on agriculture, and that's a very large percentage. Also, agriculture productivity needs to grow across the country as a large employer, but also, with changing food habits, with changing terms of trade, particularly with manufacturing and particularly with services, agricultural productivity needs to be enhanced to really catch up with the rest of the economy. And so these reforms are long overdue. But labor reforms, now eventually it is for the states to implement, and every state for that matter. But labor reform have been one of those immovable sort of objects, which for the longest time central governments have shied away from. And this government has made an attempt, a serious attempt to change the basic 4 labor codes. Land, we're finally making an effort to digitally map cadastral maps and give land documents, because without ownership or titles, trade is very difficult. So particularly in land, not just property, but land has been very sticky subject, mostly on account of poor titling. So I think that effort to move these basic factor markets of land labor, to make it more, make it easier to have transactions. So truly these are reforms which have been major, and the implementation is something to watch. This is the latest budget. This is speech analysis. We do a lot of big data analytics. I love doing this because, there are numbers, and as an economist, we look at the amount of money, allocations, spending, etc. But sometimes intent is also important. And budget speeches, we started to analyze speeches over time to see what is the overall strategy? What is the intent of the government? And budget speeches over the last 50 years are telling us that finally, if you look at the bottom quadrant, you're seeing that privatization, divestment, disinvestment, huge surge in its, in the speech, this year's speech, meaning, the strategy appears to be major infrastructure spending, what is going to get us out of this growth slowdown, or really put us on the path back to exponential growth, which is truly what we need, given that our income levels are still $2,100 per year per person. So we've just come out of poverty, low middle class, middle income country. We need to grow. And the growth strategy of the country seems to be major infrastructure spending, short-term borrowing. There's not much regard for inflation, but privatization or divestment is going to be the long-term strategy. And that is a major break from the way we have been seeing, we've seen past budgets of the last many, many years now. In fact, after NDA 1, Vajpayee's time, the talk of privatization divestment has only now begun to pick up. And this is what I want to finally end with. You're all concerned with credible news. And credible news in some sense is becoming an oxymoron. This data is the GDEL data. Again, I encourage the data scientists and the people who are interested and trained in these methods to go out and analyze this data. This is fascinating data, freely available. The GDEL data, which is from Google. It tells you this is for, most major media news outlets globally in all languages. And there is something you can measure the tone of the media, meaning positive tone is, of course, you say, good things about the country. Negative tone means bad things about the country. And this graph, to me, when we started to analyze it, we weren't very sure what we would get. We were just keen that how does media globally cover different countries? China has consistently, and this we started looking since last April, because we said, now COVID's, we know the origin. Well, we're trying to know the origin. The last WHO team that went there had difficult time getting access to data, etc. But we know it has come from China, as have most viruses and sources of pandemic in the last several decades. But could COVID and its origin have dampened the global coverage of China? But this, you see, the coverage that China gets in the global media consistently improving and positive. Compare that with open democracies, Sweden, India, and of course my focus. This is not the first time we're doing this analysis. We've been doing this for several years now. We usually compare India, China. This is the price of democracy in some sense, because democracies, open democracies, plural democracies, will see a lot of noise. You're all sitting in the US, you're sitting in the heart of it. There is a lot of noise, right? People have their say, it's an open society. We're still trying to figure out how to figure out noise and misinformation from credible news. But clearly there seems to be a trend here that a country like China is seeing consistent positive news coverage. And this is not Chinese media, this is global media. Compare that with open democracies and compare that with India. We are consistently, in fact, the trend seems to be consistent, but also always negative. This is, of course, an average, right? I mean, there are huge standard deviations, meaning there will be days when India gets a good coverage, when we send satellites and when good things happen. But by and large, these are averages. India gets very poor global coverage. News, I would say, global includes again India, and that's India. But that's also, true for Germany, true for US. And of course, India is particularly bad in most coverages. But that's the reality of, today's news. And therefore, the need to do more analysis and try to break misinformation and make sense of situation using more and more data. Now, data is also throughout every slide I presented to you, I try to give you a sense of why it is limited and why, you have to be modest in your claims. But the reverse is also true. When averages are consistently speaking about something over time, then we must acknowledge the reality of it. And I think that is like the beginning of how we try and solve this larger, bigger problem of misinformation and negative campaigning, etc. So I'll end with that. I'm very happy to take questions. Thank you.
Thank you, Dr. Ravi. It was very informative and a very interesting talk, especially the statistics and the charts and the overarching effects of COVID-19 that you have put in perspective for us is really useful for the people who are in the field of economics and also for the outsiders or the layman, like everybody can understand, because it's such a visual information and the way you presented was really appreciated. So thank you very much. So now we'll open this session for questions. Let me see the questions we have from audience. Oh, we have a bunch. Okay, so there is one repeating question, Dr. Ravi, that we have is, because we have a mixed crowd from India and US, we see a little bit of different dynamics, how both the countries have handled this crisis and how people, especially the population and the like Indians and Americans have responded to this pandemic. So one question I see is repeatedly asked by from audience, like a person named Keshav Patel from Vaiju Vijaya, and I also reframe it for myself. So the question is, how um, how do you see the differences of handling this crisis between India and US? And as you mentioned that, there was low fatality rate or per capita deaths in India when compared to rest of the country, or will focus on US especially. So is it because of like some sort of innate immunity or favorable climate or, lifestyle of Indians? One person has asked about the Ayurveda that we follow and, the regular like home medicines and in general, like the food we eat and the way we live our day and the generational knowledge that we have shared through from older ages. So do you think any of these factors might have played a role?
I think all of these factors would have played a role. What becomes difficult as empiricists or people who are analyzing as researchers to say how much of an impact was because of this and how much was because of another factor. But one thing to recognize, because we have seen differences in the way the pandemic has been dealt at the policy level. I think we must give credit where it's due when we see that, the leadership in India. Now remember, it's a large, very large country with limited health infrastructure and huge variations. We have some of the best corporate hospitals. We have some of the best public hospitals in Delhi, Bombay, etc. But there are many parts of the country which have very limited health infrastructure, right? The knowledge, the fear. So the huge variations. Now, given this uncertainty and given the picture that was painted in the beginning, how bad, fatal this is going to be, as the epidemiologists informed us or warned us, the way the Indian leadership dealt with it, we have not been science deniers. We have limited knowledge, yes, to a very large extent. Our own policy interventions were based on how things were moving in the OECD countries. So myself, I was analyzing not just Johns Hopkins data. Ideally, ICMR, we should have had local level data come in. I mean, we are hoping, we have a lot of data, but the system that is required to aggregate and put this data together to say, every day, like Angela Merkel was going, once a week and describing R naughts to her countrymen, because that is the data that was available. We don't have that capability. That is number one. So we must recognize that we were still driven by the parameters coming out of the richer countries because they have the data systems and they have the data analytics capability to come up with that knowledge, right? In our case, it was very limited. That's number one. But despite that, we have never seen leadership make unscientific claims. I think it was not just Prime Minister Modi, but the health minister, the state chief ministers, the health ministers of states, a large federal country, health is a state subject. I think the way the country was mobilized, and I think this is where when people compare President Trump with Prime Minister Modi, I think it's also a bit of a caricature. I mean, I must be honest, because we've never seen the Prime Minister make unscientific claims. Mask was very, very important right from the beginning, trying to mobilize societies to finally coming behind or sort of galvanizing movement towards, recognizing healthcare workers, because they were really the front line workers facing the brunt of the risk in the beginning. They still continue to do that. So we didn't have a confusion. Of course, at the local level, at the implementation level, there were lots of variations, right? Some states did much better because they have the health infrastructure, and I think they were far more receptive to science. And generally, governance is good in some states. Some states struggle. They still continue to struggle. But we did not see the kind of anti-mask campaigns or denying the fact that, it's just a cold. Nobody said that in India, like Bolsonaro did in Brazil. So large federal countries, when they have this kind of cavalier attitude at the top, it will percolate down. It will turn into a bigger mess than it ought to be. And for us, we could not afford that kind of a mess. So I think it's important to recognize that we have never been anti-science. Despite our limited resources, there has been quite quite a high degree of certainty in what the long-term strategy is going to be. And remember, in the beginning, there was a lot of criticism for the kind of lockdown India brought in. Not only was the short notice a problem, and that continues. I mean, we could always, in hindsight, many things could have been done better. I think every country today will have a similar sort of a response. But the stringency of the lockdown, there's no two ways about it. Our rural areas have such limited health infrastructure that if we allowed for major mobility between states, if we saw surge, rural India would never have been able to handle the kind of numbers we saw in the cities. So, I think that becomes one sort of variation, the difference between what the experience we saw in the US and here. Now, even in the vaccination drive, India has never truly had vaccine hesitancy in the past. We have had some isolated events where doctors were chased away because, there was misinformation, some pockets. Unfortunately, some of that it's been happening in Kerala, one of our most literate states. But, that is the nature of that has happened, but in a very small pocket. But by and large, the vaccine hesitancy, which we are seeing in many of the other countries, or vaccine deniers, we don't have those kind of problems. We have a problem of supply that, we just don't have. $2,100 per capita per year should be an indication. And that's why I keep saying this repeatedly. It's not just the average population. It's also a reflection of government capacity, the health infrastructure, private and public, very, very limited. So we had to be a lot smarter for to maximize the bang for the buck, as Americans would say. So I think there have been variations, and clubbing Modi with President Trump and Bolsonaro, I think it's a bit unfair because it has not been the case. It has clearly not been the case in terms of management. Now, the second part has to do with our lifestyle. I'm sure it has had a play. Like when I say, why did the numbers begin to come down? Or why has the death per capita per million been relatively low? Why has the severity of the infection itself been muted compared to the richer Western European countries, US, etc.? Immunity has to play a role. It's just that we don't know. We need the science to come out and measure and tell us that what is it about immunity within India? Is it the fact that we live with so many pathogens? We live with so many different kinds of viruses, including different kinds of coronaviruses, which perhaps lends that kind of immunity to us. The second is, of course, the level of immunity itself. Again, comparing immunity across countries is also a very, very difficult exercise, because we don't have the high degree of sanitization, the kind you see in richer countries, right? I mean, we have a lot more. We do have environments which are not as sanitized or as hygiene in many cases, right? But all of that also lends to immunity. In this case, it appears to have had an impact. But the past, I think, in the beginning of the pandemic, people's consumption of Ayurvedic, I did, for instance, because, the packets which were distributed amongst the population in states like Kerala, Tamil Nadu, etc., it includes, and I think parts of Maharashtra too, it includes, mostly Ayurvedic, we don't call them medicine. They're just, the certain roots, you boil the water, you drink water, it's good for you. And I think these are lifestyle practices which families, communities, we have just been doing it for years. Yeah. Where we lack, again, Vidhi, and this is a very important point, particularly for the scholars, researchers in the room, we need better scientific inquiry. Yes. We need more documentation. We need more trials, scientific trials, randomized controlled trials of a lot of our Ayurvedic interventions. But we are seeing, like even in allopathy, which is much more scientific in its approach of trial, and therefore more published, peer-reviewed, the scientific method, modern method that we recognize, I think Ayurveda will have to adopt these new methods of credibility, verification, etc. So the idea should be to sort of promote that line of inquiry. But we recent a very large study out of multiple different sites tells us that post-surgery, cardiovascular surgery, heart surgeries, patients recover much faster and better through yoga. But that has been done through trial, randomized controlled trial over multiple locations. So we believe that.
Yes.
Something that perhaps all our grandparents or our parents would have believed in. But now we need to see the science. And I think with the world becoming more, measurable knowledge focused, I think that is also something we must encourage, because as families are, nuclearizing, as families are urbanizing and becoming global citizens, moving away from India, etc., that knowledge might disappear. And I think that is the bigger tension. And that's why documentation becomes very important.
Agree. That's actually a point of my concern as well, because something as small as turmeric, it became so famous in the time of COVID, even in US, we used to see the capsules and tablets on the shelf, which I did not see before, because people realize that how it helps immunity. And that is, I think, ancient knowledge, which needs more validity with modern science. And if done right through clinical trials and produced more evidence, I think it will be accepted across the globe, and especially by the Western countries. So it's very
important to note that while it will be accepted, all of us are drinking turmeric milk. When you fall sick, there's no way your mother will not make sure.
Yes.
Right. So there are life practices which I think Indians have imbibed. It's the way we live. But I think that validation exercise is also very, very important.
Yes. Yeah. Thank you so much. So let's go to our next question, which is from Shir Sagar. The question is, I would like to ask Professor Ravi about the estimated future costs of pandemic, like lost time in education, therefore leading to maybe a less skilled manpower down the line, and of course the added cost of sudden breaks applied to the economy. So or probably we can discuss imminent implication of this pandemic and the long-term, subsequent implications that you foresee coming.
Again, it depends on what you are measuring. Remember the decline in GDP. These are obvious and measurable sort of costs.
Yes.
But we are also only beginning now to see the long-term implications and the long-term costs. There has been a recent survey done across around 16,000 plus students in 5 states of the nation. And we are seeing a learning loss amongst children in primary school, 2nd to 6th graders, where number recognition, language, losses. So these are going to be long-term losses, and let alone, these are now measurable. Math, and again, language is something we measure. The children are also mostly learning from their peers. A lot of social skills, communication skills are happening through interaction, physical interaction, right? And that has completely broken down in the last 1 year. So I think we are only beginning to see what the long-term impacts are going to be for this generation in particular, the youngsters. Because, by now there is enough evidence in the economics literature that early interventions, early childhood education matters for longer term well-being and sort of economic well-being in particular. So that is a point of concern. What you also have to, however, see is the long-term benefits. And the long-term benefits have to do with very quick technology adoption. Now, I know that there are many parts of our country where children have had to study on mobile phones of parents. And so families have had to juggle tremendously in trying to educate children in small, rooms, multiple kids, you don't have multiple gadgets. That tension is very real. But despite that, the adoption to this way, just the fact that you and I can have a conversation, or I have been able to teach classes online. It's not just the higher education, it's not even younger kids, ordinary people have adopted new technology. Businesses, I think, are fundamentally going to rethink the way they are structured. Do you need to have 9 to 5, 5 days a week? Can we rethink? And there will be cost implications of those, right? The other will be perhaps, again, we don't know how much technology is too much technology. Because we also, this form means there are no weekends. People are working round the clock,
Yes.
and the longer term cost, again, if you look within the household, gender implications, I think the pandemic has been particularly difficult for working women, because you have one child screaming from here, another, and all of that is very cute when you see on BBC, but it's not cute when it is a reality you've had to live for 24 hours over the last 12 months. So women have had it quite tough. Second is, on a more serious note, domestic violence, intra-household tensions. Not everybody has a very happy, family life the way we think, everyone ought to, and that's the whole idea of having a healthy society, healthy community. But, these are things we haven't even started to measure, right? So the long-term implications on mental health, just isolation itself will lead to all kinds of new tensions. And we do have, in fact, depression is one of our biggest causes of morbidity in India. Now, this kind of isolation, I'm sure, is having major impact. It's just that we haven't started to measure. So, yeah, sorry, that's a very typical economist answer, because I don't have there are so many things I'm seeing unfold.
Yes.
That at the end, we will know in net whether this has been, how much good has come out of it. But there are many things which are unfolding in front of our eyes. We'll know with time.
Yeah. Okay. So just following up what you just mentioned, like as an economist, you kind of review different data. One of the questions from the audience is also like, what is the source of the data that you presented and the data that you review? And are those data publicly available?
Every data that I analyze is publicly available. And that's why I've mentioned it a couple of times. I encourage those of you interested, go and download and work on these data sets. They are all, they are large, they are freely available, they're free to download. I'm happy to share codes of any of these. I often do with my students. So, they're all publicly available.
The other question is from Yogesh Rathiji, and he wants to know that given that Covishield has 2 different dosage regimen, half dose first and full dose next, was found to be more effective than 2 full doses, do we know which regime is being followed in India?
We not just for Covishield, Covaxin as well, we have 2 doses. The first, and then what we call the booster shot. And which is, the first shot itself is showing very high efficacy. The second dose is meant to be between 28 days to, so between 4 to 6 weeks. And we are following the 2 doses. We don't have that discussion right now, which you are having in the US regarding first dose first. So to make it equitable so that more and more people get it. And I think the reason we are not having that discussion here is that the supply is not seen as a constraint right now for us. And I think that has to do with the manufacturing capacity within India. The speed at which we are administering, which has now begun to pick up, and yesterday we had more than 1 million. We have the manufacturing capability of the Serum Institute and now Bharat Biotech seems to suggest that we might be able to do 2 doses as per the current schedule. Of course, the idea is to do 300 million, the most vulnerable, by July. So we are behind schedule, but if the speed is what yesterday was, we can pick up now with private sector. I think you'll see a pickup.
Thank you so much for answering that. One question from Sharadji Amin is requesting to share this information with NPR and some important think tanks in US. We have published from India immune memory in mild COVID-19 patients, and an unexposed donors reveals persistent T-cell responses after SARS-CoV-2 infection.
Great, please share the link, and Bharatiyam should circulate this. And I will be more than happy to also share it, social media, etc. Because at the end of the day, I mean, immunity and how individuals within India,
Mhm.
If the research is telling us that the T cells are present for a long period of time, or meaning the antibodies are present for a long period of time, it is telling us that perhaps reinfection is not as much of a concern here as it is still a fear. The second is the variant, the different variants we are seeing now, UK, Brazil, South Africa. Uh, that is not a big problem here currently, not yet, we don't know of. But if this is published work that he's referring to, we'll be very happy to,
Yeah, he said it's accepted, maybe not published, but it's accepted.
Oh, congratulations. Accepted is as good as published as far as researchers are concerned. That should be a good study, yeah.
And the last, we have a lot of questions, but I'll take it as a last because of time constraint now. So last question is, what can those of us who live in the US do to have the press provide more accurate information or news about India? So like referring to international press coverage that you just mentioned, the graphs that you showed, and how different countries are represented differently. Is there anything that can be done or any insights in that regard?
Look, from what I gather, the profile of the audience here, you have had the best of education as Indians and as global citizens. You have the knowledge, and many of you have the required training to be part of this research movement. Because at the end of the day, the narratives which get built, I mean, I went in with a very open mind. I mean, I was very clear we are going to see the kind of surge that the epidemiologists had projected. In fact, when I was making cost estimates, those are the projections that I kept in mind when I was preparing, sort of a budget to see what kind of money we'd have to spend. So I believed those early numbers, and which also scared me like it scared everybody else. And of course, now we have benefit of doubt, etc., etc. But I was equally surprised how sometimes eager people were to just, criticize everything that is happening in India. The level of cynicism, and perhaps it is in most, I mean, at least the GDEL data analysis seems to suggest that most open democracies share it. But for Sweden to get negative media coverage is not as much of a problem as it is for a low middle income country with limited capabilities like us. Because, especially when you're dealing with a mass, like huge population, which is looking for credible information, it's not just normal citizens in the country are also looking for credible information. So the kind of fear, and I would even say that today the hesitancy of the vaccine, which we have never seen. Indians have been more than happy to take their children for polio every Sunday. Why? Because Amitabh Bachchan said so.
Do boon zindagi ki.
Right? So we have not had, and now we are. And I think some of it is on account of the way we have covered it. Modi's vaccine. Right? I mean, it's a BJP vaccine. When you hear conversations, it has real damaging impacts. The impacts are not limited to media. I think society, there is a problem. And I think the best way to fight or to contest or to get the truth out, and truth, of course, who knows what is truth, but as empiricist, I have more faith in data if analyzed well than somebody's opinion. So join that effort. Look at the data, write the stories, put it out there. And this is a large community. I think we are a sort of a growing tribe now who would much rather believe research than an opinion piece or an editorial of a newspaper somewhere, which believes that India can get nothing right. So use the power of data. I think that is the biggest tool we have right now.
Yes, absolutely. And we all agree, I think that is the way forward. And ending this talk, we would just like to thank you, because your talk has been kind of amalgamation of like social science, economics, and health, and kind of overarching effect of all the things that's happening during this pandemic. So very fascinating, and it's truly a matter of pride to know that how well India has done, and it's great information for all of us to understand it from you today. So thank you very much, Shamika ji, for spending time with us early in the morning. And also, like, one thing I would say personally is vaccine dose for us might take some time. When we'll get, I don't know, but this dose that you give us through Twitter, like, the knowledge about COVID and the current affairs is really something that we look forward to. So please keep it up, and thank you very much.
Thank you, Vidhi. Thank you, Bharatiyam, for
Namaste.
inviting. So nice to be here with all of you.
Namaste.